Welcome. Today we're diving into a serious heart condition linked to kidney failure, uremic pericarditis. This condition affects the pericardium, the sac surrounding the heart, and it's crucial to understand it, especially if you or someone you know is dealing with kidney issues. Uremic pericarditis, at its core, is caused by kidney failure, specifically the buildup of waste products in the blood that the kidneys can no longer filter out effectively. These waste products, or uremic toxins, irritate the pericardium, leading to inflammation. The longer and more severe the kidney failure, the greater the risk of developing this condition. While dialysis can help remove these toxins, uremic pericarditis can still occur if dialysis is inadequate or not initiated promptly. Now let's talk pathophysiology. The buildup of uremic toxins in the blood directly irritates the pericardium. This irritation causes inflammation and fluid accumulation within the pericardial sac. This fluid buildup, if excessive, can lead to cardiac tamponade, a life-threatening condition where the heart is compressed, limiting its ability to pump blood effectively. Furthermore, the inflammation can cause the pericardium to become thickened and scarred, potentially leading to constrictive pericarditis, further restricting heart function. Epidemiologically, uremic pericarditis is primarily seen in patients with advanced kidney failure, particularly those who are not yet on dialysis or are receiving inadequate dialysis. The exact prevalence is hard to pinpoint, but it's estimated that affects a significant percentage of individuals with end-stage renal disease. The risk is higher in those with poorly controlled kidney disease and those who delay seeking treatment. The signs and symptoms of uremic pericarditis can vary, but common indicators include chest pain, often described as sharp and stabbing, that may worsen with breathing or lying down. You might also experience shortness of breath, fatigue, a low-grade fever, and a pericardial friction rub, a grating sound heard with a stethoscope as the inflamed pericardium rubs against the heart. In severe cases with cardiac tamponade, symptoms can include dizziness, lightheadedness, rapid heart rate, and swelling in the legs and ankles. Diagnosing uremic pericarditis involves a combination of clinical evaluation and diagnostic tests. A physical exam will look for the characteristic pericardial friction rub. An electrocardiogram, or EKG, may show specific changes indicative of pericarditis. An echocardiogram, an ultrasound of the heart, is crucial to assess the pericardial fluid and heart function. Blood tests will confirm kidney failure and measure uremic toxin levels. Finally, in some cases, a X-ray or CT scan may be performed to rule out other causes of chest pain and shortness of breath. While there aren't specific types of uremic pericarditis in the traditional sense, it can be classified by its severity, such as with or without cardiac tamponade, or by the presence of specific complications, like constrictive pericarditis. These classifications help guide treatment decisions. Treatment for uremic pericarditis focuses on addressing the underlying kidney failure and reducing inflammation. The primary treatment is intensified dialysis to remove uremic toxins from the blood. Anti-inflammatory medications, such as NSAIDs or corticosteroids, may be used to reduce pericardial inflammation, but these are used cautiously in kidney patients. If cardiac tamponade develops, pericardiocentesis, a procedure to drain fluid from the pericardial sac, may be necessary. In rare cases, a pericardiectomy, surgical removal of the pericardium, may be required, especially if constrictive pericarditis develops. Preventing uremic pericarditis relies heavily on proactive kidney disease management. Early diagnosis and treatment of kidney disease are paramount. Strict adherence to dialysis schedules and dietary restrictions is essential for those already on dialysis. Regular monitoring of kidney function and uremic toxin levels can help identify and address any issues promptly. Avoiding nephrotoxic medications, drugs that can harm the kidneys, can also help. The prognosis for uremic pericarditis depends on the severity of the underlying kidney failure and the promptness of treatment. With adequate dialysis and management of complications, many patients can recover well. However, untreated uremic pericarditis, especially with cardiac tamponade, can be life-threatening. Recent research focuses on improving dialysis techniques to better remove uremic toxins and developing more targeted anti-inflammatory therapies with fewer side effects for kidney patients. Furthermore, studies are investigating the specific roles of different uremic toxins in causing pericardial inflammation, which could lead to more specific treatments in the future.